If we look at the structure of the skin, we'll see the extracellular matrix occupies that whole region in between the fat cells in the hypodermis, right above the muscle layer. This entire area in the middle is where everything, all the action takes place that we're concerned about right now. So the fibroblasts that produce the collagen, the hyaluronic acid is water soluble. It creates water, it builds water within the cells. It increases the cell's elasticity. Of course, the blood vessels are carrying oxygen, which the entire ECM, the extracellular matrix, requires in order to keep growing. So that's the basic structure of the cell. But what's the difference between a healthy cell and a non-healthy cell, or a young skin and aged skin? From this diagram, you can get an idea. It's intended to be illustrative. It's not a photograph, obviously. But what you're showing in between the epidermis and the hypodermis, between the top part of the skin and the lower part of the skin, is all of the healthy collagen. The fibroblasts are multiple. The hyaluronic acid, there's a lot of them. The fat cells are minimal. They're small, but they're there, but they are small. They're not infecting the skin. The elastin is there. Everything that contributes to the healthy appearance of the skin is all there, all multiplying, all doing their individual jobs. The aged skin, you can tell by comparison, is deficient in collagen, deficient in elastin, deficient in hyaluronic acid, and the fat cells are much larger. What that does when you have a lot of very large fat cells is they're lumpy, and they create the kind of lumps, the kind of wrinkles in the skin that you don't want. There's an excess of fat, and there's a deficit of the collagen and the elastin, the hyaluronic acid. The fibroblasts are not producing enough collagen. The cells are basically dying off. The cells are not reproducing the way they should be. They're not taking care of the waste materials in the cells. They're not transmitting this. Everything is kind of slowing down. There's not enough water in the cells. That's another problem. And the water that's there is not moving as quickly and as efficiently as it should. So as you can see, the difference between the aged skin and the young skin is obvious. What you need to do is you need to replace all those things that the aged skin has lost. And you can do that without surgery, and you can do that without too many drugs and creams and things like that. Some, maybe, but